Hello and welcome to Health and Wellness Save a Life. Now, every life is invaluable and precious. The problem of sudden cardiac death is a major concern all over the world, and it affects people of different age groups. When it comes to India, the problem has escalated because of a sudden change in lifestyle and food choices. When medical emergencies like cardiac arrest happen, it's very important to be prepared. If you're aware and informed, then you can take steps to revive a person and save his life. Worldwide, millions of people die of sudden cardiac arrest every year, and this is partly because of limited and sometimes ineffective bystander CPR or cardiopulmonary resuscitation. This program is meant to raise public awareness and understanding of the practical applications of CPR, and as always, we're joined by medical experts who will do exactly that in the course of the next half hour. Joining us, Dr. Deepak Agarwal, Senior Consultant and Interventional Cardiologist with Hridayam Hospital, Agra; Dr. Kamlesh Thakkar, Interventional Cardiologist and Head Cardiology Unit of the Galaxy Heart Institute, Ahmedabad; and Dr. Ranjit Palkar, Consultant Interventional Cardiologist with the Kamal Nayan Bajaj Hospital in Aurangabad. Dr. Agarwal, let me begin with you. Are heart rhythm issues fatal? Just how many kinds of heart rhythm disorders are there, and what do we know about them?
Yeah, definitely. Most of the heart arrhythmias are non-fatal, but some heart arrhythmias are very much fatal, like ventricular tachycardia and ventricular fibrillation. These are very extremely fatal, and they give no time for to manage. And there is only 1 or 2 minutes in which we can manage the patient and we can survive the patient. So these are the very much important that when the patient experiences some arrhythmia, there is the standby patient may give a CPR, or should the primary resuscitation process is a very much important. Heart rhythm problems occur when the electrical signals that coordinates the heart beats does not function properly, and it may be a very much slow, that is a bradycardia, or it may be a very much high, that is a tachycardia. In tachycardia, it may be from the atrial tachycardia, it may be from the ventricular tachycardia, and most of the arrhythmia which is common in hypertensives and diabetics also, and which comes without any warning sign, and patient just feel palpitation, and the fainting symptoms are there. But the most common arrhythmia, that is the atrial fibrillation, it is not non-fatal. We have not to worry, but sometimes the patient just faint down and the rhythm is very much fast, which is a ventricular tachycardia or ventricular fibrillation. We have to give the cardiorespiratory symptoms. Ventricular fibrillation, it may lead to sudden cardiac death, and if the pupil do not receive treatment for the arrhythmia, it may cause fatality.
Right. Dr. Thakkar, what are the pre-existing conditions that may actually increase the risk of cardiac emergencies?
Madam, there are so many conditions which increase the cardiac emergencies, particularly if the patient is having diabetes and the diabetes is long-standing, uncontrolled, then definitely he is at the risk of the increased cardiac problems. Then comes the uncontrolled blood pressure, that is called as hypertension. Then comes the sedentary lifestyle or inactive lifestyle, or obesity or overweight, that can also lead to increased cardiac emergencies in a given case. Then if your family has a strong history of coronary artery disease or heart attacks at a younger age, then you are definitely at an increased risk of the cardiac emergencies. If you are having a substance abuse, particularly cocaine use in youngsters, collegians, which we see that the drug abuse is increasing in our society, that also leads to the acute cardiac emergencies in younger population. And if you are a smoker, chronic smoker, or you are consuming tobacco in any form, then also it increases your cardiac risk. If you have a certain other disorders or disease in your body, like a chronic kidney failure, that is called as CKD, or if you have a past history of a severe stroke or a paralysis, then these patients are at increased risk of the cardiac emergencies. And one last group of the patient, if you are already a cardiac patient, means you had a heart attack in the past, or you had undergone angioplasty or a bypass surgery, and in those given cases, if you are not regular at your medicines, if you are not regular at your lifestyles, if you are not following the substance abuse like smoking, tobacco or alcohol, then definitely you are at increased risk of the cardiac emergencies. High cholesterol can also add to increased cardiac emergencies.
Right. Let me also bring in Dr. Palkar at this point. Could heart palpitations accompanied by shortness of breath actually be dangerous and be serious? When this happens, what should we be doing?
Yeah, absolutely. Because I think palpitation is something which is the most important symptom for diagnosing such kind of arrhythmias that we are discussing today. See, what happens is palpitation is nothing but you feel your own heartbeat. And when you are feeling your own heartbeat, it is an abnormal feeling, right? Because normally we don't feel our own heartbeat. What happens whenever you get such palpitations on and off quite frequently, and they last a little longer, then definitely it should be thought of some medical ailment. Of course, whenever the palpitations are associated with shortness of breath, some additional symptoms, say like chest pain, fainting, then in such cases it has to be dealt emergently. In such cases, you should consult a cardiologist or a physician, get an ECG done, so that, as discussed by Dr. Agrawal, the ECG will notify the problem that we have. It can be either a very slow heart rate, so less than 36, that is 50% of the normal heart rate, or it can be a fast heart rate, say more than 120. So both of these can diagnose the problem that is associated with palpitation, and of course we can then rightly treat this particular issue. I think in all such cases, whenever you have palpitations which are associated with the shortness of breath, chest pain and fainting, definitely should be considered serious.
Right.
So it is not always serious, but then these are the conditions where you should look upon seriously.
Dr. Agarwal, if you could explain to us the difference between angina and a heart attack, and what is the first aid that can be offered for chest pain? Dr. Agarwal?
Yeah. Basically, angina is the chest discomfort. It may occur, chest discomfort may occur at any level from umbilicus to the jaw, and it may cause radiation to the arm, left arm or both arms, and sometimes it may goes to the back. The symptom of chest discomfort is caused angina. But when the chest discomfort lasted more than 20 minutes, it converted into heart attack or myocardial infarction, in which myocardial infarction we say when there is some abnormality of myocardial muscles, whether there is something in the echo, then there is some hypokinesia, or it may occur in, it may cause the troponin T or cardiac enzymes to be elevated. When there is a death of the myocardial muscles, we call it the heart attack. So in that scenario, we have to rush very fast to any medical expert and to take the advice and get the ECG done and other investigations. And there is, one thing is important: when there is a chest discomfort not immediately relieved by any other process, then it is a very important medical emergency, and in that scenario we have to rush to the medical expert and get the treatment done. The time is very important process. Sometimes at that time many life-threatening arrhythmias can occur, and in that the patient, we say that sudden cardiac death in that, and which is very common in the first hour of the myocardial infarction.
Dr. Thakkar, how many minutes of a cardiac arrest can a patient survive? And, is there anything that can be done for a patient while waiting for emergency care, an ambulance, etc., to arrive?
This is very nice question. If cardiac arrest lasts more than 8 minutes, then the survival chances are very less. Brain damage starts within 4 to 5 minutes of a cardiac arrest unless the CPR is started and given properly in time. So until the ambulance arrives, what you and me can do, that take the person to a safer place. Don't do CPR on a highways or on a busy traffic roads, because it can endanger your life also and the victim life also. So bring him to a safer place, start CPR immediately, make his neck little bit extended like this, so that will make his breathing easy, the airways will be straightened, so the breathing will be good. Even in a CPR, when you give a mouth to mouth breathing, that is also helpful in those CPR cases. So as soon as you see any person who has collapsed, who is unresponsive, who is not taking proper breaths, just do CPR. And you ask your bystanders to call ambulance. You do CPR and ask other person to call ambulance, and till the ambulance arrives, you continue CPR. That is the thing which can survive the life of any given victim.
Right. Dr. Palkar, now lack of CPR awareness is of course a big health challenge, particularly in India. So, if you could, it would really help if you could run us through all the steps, the main steps of CPR.
Yeah, so of course, lack of healthcare awareness and as well as lack of CPR awareness is something which is a great health challenge in India. What exactly we all should know about CPR is we should at least know some basic steps, so that by the time the medical team is arrived, you should be able to help that particular patient. So as just discussed, we should start CPR immediately, because just a 5 minutes gap can be an deleterious to your patient or even a family member sometimes. So what we should do is, we should first approach patients safely, see that the scene is safe. So once you take the patient to a safe zone, you start assessing the patient. If patient is really unresponsive, meaning he's either gasping or if there is no breathing at all, that means it's a time to call for help. You should always get somebody to assist you, because it's always better that you get someone to help to do the CPR. Once you call the emergency number, the emergency team will be on the way, and by the time you can start the chest compression. So how the chest compressions are to be given? You should put heel of one hand on the center of the chest, that is the breastbone or sternum, what we call, and then it should be done at a rate of around 100 per minute with almost 2.2 inch depth that is to be performed, so that the heart circulates the blood throughout the body. In between the pumps, you should allow heart to again recoil, so that the chest get all the blood from the, and then this cycles to be performed for 30 compressions. After 30 compressions, there should be 2 rescue breaths that should be given, each for 1 second. Right. This whole cycle should continue till you get a response by the patient, or till the medical team arrives, yes, or at least for 30 minutes.
All right. We will take a quick break at this point, but there's lots more to talk about, including how lay people would know that they're carrying out CPR correctly. All of that coming up right after this quick break. Welcome back to Health and Wellness Save a Life. We've been talking about CPR, about the difference between angina and heart attacks, and also, of course, carrying out CPR. So how exactly would a layperson know whether they're carrying out CPR with the right technique? What are the results that he or she should expect? And, what duration is this given for? Dr. Agarwal, if you would like to take that.
Thank you. First and foremost is the chest compression. Mm-hmm. The chest compression is the major part of the CPR, and we should take our body weight for doing the CPR, and the fulcrum of our body weight should be on our hip bone, and the arm should be the straight one. And the chest should compress, as rightly said by Dr. Palkar. It is about 2.5 inches and 2.5 inches should compress the chest wall, and when it should be relaxed in between that. And about 100 to 120 compression per minute is very important. Also, we need to see that what is the rhythm of the patient. If it is a ventricular fibrillation or tachycardia, is there any facility of defibrillation or cardioversion? We should try also that in that way. And otherwise, the person should try to for CPR, cardiopulmonary resuscitation, and after 30 seconds should the 2 breaths should be given, and in this way the patient can the chances of survival is very much increased when the medical team arises and for the patient. Many patients revive with just right technique, and this way if the patient knows how to give the CPR. Also, my suggestion is lay person should get training of the CPR widely in our country, and most person should know how to give the CPR. Right. And it is very easy, it is not very difficult. And chest compression is a very important part of that. Also, the person should continue the CPR when if the patient does not revive, and up to 30 minutes CPR may increase the chances of recovery. Okay. Also we should see the pulse of the patient, whether it is coming or not with the CPR. The second person also should be there for monitoring.
All right, so you're saying that at least 2 people should be there, the second person for monitoring. But Dr. Thakkar, what if someone is not giving CPR perfectly correctly? Is it still important to intervene? Can imperfectly given CPR also be a life-saving technique?
See, the CPR definitely saves a life, provided it is given correctly. Even hands-only CPR is also useful in saving a patient's life. So, and the life saving depends on the cause of the cardiorespiratory arrest. If the cause is just a low heart rhythm, means bradycardia or a complete heart block, then the CPR definitely prolongs or survives the life if it is given on time and for the required duration of 30 to 45 minutes until the emergency services arrives. If arrest is because of the tachyarrhythmias, that is ventricular fibrillation or ventricular tachycardia, then this defibrillation is very important along with CPR. We are seeing these defibrillators on the airports, on the bus ports, railway station, where EED is written over those machines. These machines are helpful in giving electric shock to the patients that will stabilize the tachyarrhythmias of the heart. Third thing is, if the collapse or arrest is because just of a neurogenic shock, like a patient had a snake bite, and because of that stress of a snake bite, he has collapsed, not because of the neurotoxins of the snake bite or cardiotoxins of the snake, then the CPR will definitely save the life. So, once you see a patient who is unresponsive, not taking breath properly, as my colleagues has said, definitely start a CPR.
Right.
If CPR is not given on time, then 9 out of 10 patients who had out of hospital arrest, they are likely to die. But if the CPR is given timely, then the survival chances is increased by 2 to 3 times, and almost 45% patients can be saved if CPR is given correctly and for a required duration.
All right. That's important to know. Dr. Palkar, how important is it that people whose relatives suffer from heart disease actually learn CPR? Is it more important for them, would you say?
Of course, because as we discussed that should be known by even every lay person, then actually the patients who are rather the substrate for getting such problem, like the cardiac patient knows with ischemic heart disease, whose LV function, the left ventricular ejection fraction is less, or who has suffered a large heart attack in past, or the patient who has a cardiomyopathy in past, definitely has a much higher risk of getting such cardiac arrest. And if you know, as a family member, if you know the CPR technique, then definitely you can save a life of your family member or sometimes your friend. So I think it is very, very important that a family member of a heart disease patient should know the technique of CPR. As we know, as we discussed, that most of these patients will have a great increase in the survival rate, especially if it is given within time. And I think the family member is the person who is usually close to the patient, and by the time the medical team arrives, family member can initiate CPR and actually prolong the life of victim.
Right. Dr. Agarwal, having a silent heart attack obviously can put a patient at a greater risk of having another heart attack, which could in turn be deadly. But, who is most prone to these silent heart attacks? Is it diabetes patients, and why is that?
Yeah. In diabetics, we call neuropathy, diabetic neuropathy occurs because of the damage of the nerve fibers, nerve endings, and which is very common in diabetes. And they do not feel the pain, which generally occurs with the heart attack. And as I have discussed before, that the angina symptoms is not there with the diabetic patient in many diabetics patient. But the heart attack is still very dangerous, and if there is the damage of the heart muscles, then it does same prognosis as there is a pain is there or not there. So many persons with the diabetics does not feel they have a heart attack, and they did not detect any abnormality in their heart. And when they get the checkup, then many cardiologists says that you have a heart attack before also. So it is important to have the other symptoms of the heart attack, whether it is a breathlessness. Sometimes patient experienced a sudden breathlessness, not the angina. So it is also a symptom of the heart attack. Of any diabetic having such symptoms like breathlessness should complain to go to the cardiologist. Also that in diabetics, the chances of heart attack is much more increased. Apart from they are not detecting, but the heart attack is much more increased. It is about 3 to 4 times high in comparison to the normal person which are not having diabetics. So in diabetics, they should be very aware of that, and regular checkup or the medicines they should take in that. Also, it is not absolutely normal, not absolutely pertaining to the diabetics. In many normal patient also have many times does not have the chest pain and having the silent attack. But the heart attack and in going to arrhythmia or ventricular tachycardia or fibrillation is same thing, same common in whether they are feeling the pain or not. So we have to very cautious about the other symptoms of the heart attack, like breathlessness, like fatigueness, like uneasiness also.
Yes. All right. Thank you for wrapping all of that up for us. That was very comprehensive. Thank you all for joining us on the show today.
Thank you.